Doctors and nurses at the San Fernando General Hospital have asked the Medical Professionals Association to investigate an incident last Saturday in which they claim the health minister came to the institution with a patient and began telling health workers who should receive urgent medical attention.
I did not interfere. That one I can say I did not interfere that night. As I said, one of my personal assistants, her daughter took sick. I went there with her daughter. People were waiting long, and I asked people how long they were waiting, as I normally do. And then I asked the doctors, why were people waiting so long? And I did ask the doctors, isn't it a rule that if somebody comes back within 24 hours that you're supposed to admit them right away? And they said yes, and they didn't know where she was, and they went to get her. So maybe they found that as interference.
The minister denied that she ordered the transfer of one nurse to another department and read patients' confidential files.
I heard accusations that I read patients' files. I did not. I spoke to patients. I did speak to patients in the waiting room, and that's it.
The health minister said no special treatment was meted out to her, but did admit to a shortage of nurses at the institution. She said patients who had done blood testing were waiting too long for the results, and as minister was well within her right to inquire.
When I asked the doctors, they said, oh, what happened is that the blood test was still downstairs. So then I asked them, what happens next? They said, well, normally a nurse would go, but they're short-staffed. So then I said, what happens next? They said, well, I guess one of us could go. And then I said, so what happens next? And they said, well, I guess we'll go now. So, of course, they may get upset about that. But the fact is, my duty as the Minister of Health is to ensure that all nationals get the best treatment that they are obligated to get.
For CNC3, I'm Roshan Sukram.